Hello and welcome to Aging Matters. This is a show that's provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. We have a great show lined up today. I'm hoping everyone is tuning in. It is all about Medicare. And my special guest, I'd like to welcome John Vogel, who is a Medicare trained specialist.
Well, thank you, Ann.
Thank you so much.
Thank you.
Our annual show.
Our annual show, yes, yes.
John provides us so much information and does it succinctly and in a fashion, I think, that helps us at least understand a little bit more than we did before, since it can be so complicated with regards to Medicare and changes, what's new, what's old, what's the same, and what do we do. So again, thank you. I know that you're a busy man and you're helping others individually with these changes, so I appreciate your time and your expertise in this information. So thank you, John.
Oh, thank you, Ann, for doing that. We just get together and do this and try to give you the best we possibly can with everything.
Exactly. So I want to start with setting, I guess, a basic for us again. If we're tuning in and have no clue, we're new. Tell us what Medicare, and everybody kind of says Medicare. No one really says A's and B's, but there are A's and B's and D's and so on, and then the Advantage or the C. So tell us what that is.
A very simple explanation on it. Medicare is made up of two parts. A Part A, when you're actually physically admitted into the hospital. A Part B, your doctors, your x-rays, your blood work, all the things that we do outside of the hospital. You get an ID card from the federal government. It's a red, white, and blue paper card. You don't get a big card. So it's a red, white, and blue card, and the only contact on there is Part A and Part B. From that, they normally call that traditional Medicare, original Medicare, whatever words you want to use. But that would mean that you have entered into the Medicare system, normally at the age of 65. There are people before time because of disabilities and everything else, but normally you come into the program at age 65. At that point, you have some choices to make. The shame of it is most of us do take some medications. They came out with a Part D, as in dog, Part D, which is the prescription plan, which goes along with your traditional Part A, Part B, and you would have a prescription plan. From there, you have a choice to go into what they call Medigap or supplemental insurance, which fits right into your Medicare Part A and Part B, or as you said, you can go into a Medicare Advantage plan. It's both the Medigap and Medicare Advantage plans are sold by the same companies. They are completely different in how they operate, but they are choices that that come into the Medicare system can make.
Okay, good, thank you. So at least we have a good base to go from. From there, it gets all confusing. So one of the reasons that we kind of do this show at this time of year is that this is the time that they allow open enrollment. And why don't you tell us what that means to us when we talk about open enrollment, John?
Open enrollment starts on October the 15th and ends on December the 7th. During that period of time, you have the option to change whatever you're in. If you are doing traditional Medicare and want to go to a Medicare Advantage, you can go that route. If you're in a Medicare Advantage and want to come back to traditional Medicare, you can go that route. If you're in a Medicare prescription plan, your Part D plan, you can change your Part D plan without any problem. So it is that choice time. It is, and the issue, Ann, that happens so often to me is the fact that people say, oh, my plan is working perfectly. I don't have to change a thing. It's just wonderful. Then in January, February, when they go to get their medication, they find out their plan completely changed, or worse, their plan's not even here anymore. So this open enrollment period, this October 15th to December 7th, no matter what you are in, it is absolutely your time to take a look and make the right choice. And right now we're making it for 2025. So during this time period, we look at and say, okay, what do you want to do for 2025? What changed in your life? Did you subtract some medications? Did you add some medications? Is there a different health issue that's going on in your life? Have you changed something that we need to take a serious look? But there's so many people who are say, oh, it's so confusing, it's so hard to do. PA Medi used to be called the Apprise program, now called Pennsylvania Medi. That is the people that operate it. They're out of Harrisburg. I work right out of here in Berks County. You can gladly call Berks Encore, and they have the contract for the PA Medi in Berks County, and they will direct you to one of the counselors. I'm one of the counselors for them, and we will gladly help you and go through all the steps. The bottom line of this is that you really make the choice. You say, can you explain to me the Medicare Advantage plans? Yes, and we can show them all that. Can you explain my prescription plan? And we can show you all of that. But it really is a personal choice, and it's so personal, Ann, that if you're a husband and wife, and I can't tell you how many, it's quite a few, they're in different plans. I take more medicines than my wife. She doesn't need as big a plan that I have. So somewhere along the line, they can figure out that, oh, I can? Oh, well, during work, we all had to be in the same, no. In this, it is an individual choice with Medicare. You go into your plan, I go into my plan, and we are good to go.
And that's one of the benefits in that case, because as you mentioned earlier, it's based on you as the individual, whether your health condition, obviously your health conditions are different, the medications are different, so that's unique, and that's nice that there are separate choices that people can make based on themselves. What then probably adds to the confusion at the same time, you know, because there are a lot of choices and options for people. And I think that I'm going to reemphasize again that the PA Medi program is a program that is non-biased, neutral. I'm not sure that's what the right word is, in that they're not. They're here to help you. They're here for the individual to make some comparisons, to know what's out there, to show you what's out there, and then, as you said, the individual makes the choice. This PA Medi counselors are not part of any insurance company. They don't get a kickback from one plan to another. There's nothing that they're getting with you choosing a particular plan or not that particular plan. So I think that's good to call them and to be able to make an appointment. And in some cases, it's also a range of what assistance you want. It may be, this is what I did, is this right? You know, or help me sit down and look at each of those things, as you said, the prescription separate, look at the Medigap, help me to look at all of that, and then I'll enroll in myself. Or they can, in fact, help you to do it on the computer right then and there, electronically, to be able to make those choices. So I think that's a great program that's available to people here.
Yeah. The other thing I just want to quickly cover for Medicare Part A is free for 98-point-something% of the country. So if you come into the system and you're still going to work and you're going to have employer coverage, please sign up for Part A anyway. It's free. It's the Part B of Medicare that has a premium, which you won't need the Part B part because, as I said, Part A is in the hospital. It's your hospitalization, but you will have it through your employer. So if you turn 65, and I can't tell you, Ann, how many people now are working till they're 70. And those 5 years, they are looking at, what do I do? Well, the employer's offering it, but sign up for Part A. For Part A. Then Part B, there will be at a time, and there'll be no penalties. You can sign up because if you have creditable coverage that's equal to or better than Medicare's, sign up for Part B with no penalties, nothing, and you're fine absolutely, so you can do that. But
uh-oh, there's always that bug coming in there. So are we moving to 2025?
We should talk about 2025, okay?
All right.
I will share, as I shared with Ann, on October 15th, I started my 30th year of doing this. And of all the 30 years, this year they have, the federal government, through Health and Human Services, have made some radical and good changes, but confusing changes for the consumer. One of the big changes that they made was the maximum out-of-pocket money for any consumer in the country is $2,000. Now, how does that work? Well, if you have a prescription, a Xarelto, an Eliquis, something of that nature, where you're spending $680 a month on that, well, you know it's going to take 3 months or 4 months, and you're going to be at $2,000. So once you reach that $2,000 in out-of-pocket money, that Xarelto, that Eliquis becomes free for the rest of the year. Now, as I am doing this with individuals, they're looking and going, "Oh, there got to be something. There got to be something wrong here."
Yeah.
But no, the $2,000. Now, the interesting part, and this is the confusing part, the interesting part is that the change in the deductible for 2025, it went up. It went up to $590. It was $545. So it went up, $45. So we're sitting there and we're saying the $2,000. Part of the $2,000 is the $590 deductible, part of it.
Okay.
So you pay that $590 deductible, subtract that from the $2,000, and I'm listening to myself in my head here, and it's like, what are you saying? Because it's $2,000 out of pocket money, but it also includes that $590 deductible. So that's one of the huge changes, because people were going into, and this was eliminated, everybody's going to clap, there is no more donut hole. The donut hole's been eliminated. So that gap, that time when you were paying such and such a price, jumped up here and you went, oh my gosh, what happened? And then it jumped back down again. That's all gone, all gone. So that well, here comes the fire truck. The $2,000 in out-of-pocket money is a true benefit for those people who spend that kind of money on their prescriptions.
Yes.
The other side of it is the federal government decided to create a payment plan. This is quite confusing for people, and I've had people call me and say, I was online and I'm trying to figure this out. This payment plan means in January, when you go in to get your Xarelto as $600, well, you don't have $600. So the federal government has come up with this concept that you don't have to have that $600. We will create a payment plan for you. So to make it easy to understand for the math, so your first month, you're going to get your Xarelto and it's $600, and the federal government is going to say all you have to pay is $50. You subtract the $50, and what the balance is, $550. That doesn't disappear.
Right.
It gets added to February. Now, February means that you would have $600 and the $550, so now we're up to $1,150 that you owe. So now your payment in February would jump up to, and I'll pick a number, $190. Okay? Now, $190 doesn't match $1,100, so you would subtract that and continue to add. The issue with this, and the part that if you're doing this by yourself to pay really close attention to it, is the fact that this is a pilot program. It ends on December 31st. So if you have a balance, if you have a balance that you owe from that $2,000, come December 1st, you're going to receive a bill and you're going to have to come up with whatever amount is left out of the $2,000. I'm being very cautious after 30 years. I'm being very cautious with people on the payment plan. I'm very excited about the $2,000. So those are two of the changes. The other big change, Ann, that really happened to us, 30 years ago we had 38 plans. Then we went to 32 plans, then we went to 27, and then we went to 21. Well, now we're down to 14.
All right.
14 plans.
They heard us, I think. They finally heard us saying, don't give us so many.
14 plans is fine to pick from, absolutely, positively. The issue is they disappeared, a lot of plans. Even the plan that I was in and I'm in this year called Mutual of Omaha, they're completely gone, disappeared. They have no plans for 2025, which put me in the position, and anyone else that's in there, that you must change your plan. Well, I will tell you, Ann, my Mutual of Omaha coverage was wonderful. It was working perfectly, and now I have to lose it. So I have to go and look at another plan without any questions. I have to look. Aetna Silver Script, they reduced and went down to one plan. There's a lot of these plans that are either disappeared completely or they have reduced the number of plans that they had. By doing that, as you can easily figure out, they changed the premiums on the plans. We still have, believe it or not, people, we still have a 0 monthly premium plan. You pay nothing at all. Or on the other end, they go to $168. So you have this big gap of what should I do? You know, it's not like, well, if I buy the $168 plan, that's the best plan around. No, you really need to study and look at the plan, put your prescriptions in, pick a pharmacy. The other thing, and I say so to people all the time, make sure, I don't care if you're in love with your pharmacist at whatever pharmacy you're at. If it's not a preferred pharmacy, you're paying more for your drugs. If it is a preferred pharmacy, and I will tell you, like the CVS's, the Giants, the Weiss's, even Walmart can be preferred through that. The idea is not only to study the plan from the price, study the plan that your prescriptions are on, study the pharmacy where you're going to get your drugs, and then you can make an intelligent decision as to which of these really 14 plans works for me in 2025.
And while you're on that, just a side question for the pharmacy situation. So you see the preferred provider, is it also somewhere, how do you find out if it's also financially better or not to do a mail order? Do they note any of these potentially having mail order associated with it?
You know what, Ann? I'm going to answer that really easy.
Good.
Mail order, when I started this, and for probably 10 years, you saved a bunch. Oh my gosh. Today, nothing.
Really?
Nothing.
Okay.
There isn't. The convenience of mail order means it's in your driveway. Oh, I shouldn't say that. It's on your porch. Okay? That's the connection between mail order now. In some cases, you might be able to save a penny here or a penny.
And it was quantity typically that was the difference too.
Correct.
So you went from just a 30-day supply pickup to probably a 90-day.
A 90-day. And now you can do 90 days at pretty much any pharmacy. The other thing when you're doing this, make sure that you keep in your head there can be a deductible. The standard deductible on the prescription plans is $590. You might not have to play with that, because here's another little thing that when people are doing this, oh, I have that $590. No, if you're taking T1 generics or T2 generic drugs, the $590 does not apply. It's from tier 3, 4, 5, 6, and specialties. So you when you're doing all this, if you're doing it especially for your first time and you went on to Medicare.gov, that is the website, Medicare.gov, and you can find everything that I'm talking about here, you will see the $590 deductible, and you will think immediately, oh, well, that's what I have to pay for.
Yes.
And you're taking a T1, a generic drug, and you go in and the pharmacist says, no, that's free, you don't owe anything. Well, I
You
thought,
think you hit the lottery?
don't I owe $590?
Yeah.
No, it's when if you take a brand name drug or a specialty drug or above. That is one of those situations where please come to our call, Berks Encore, for a PA Medi counselor to review this with you, because we've done it for so long and we understand the program. We can get into there and we can show you these little things. It's not big things, it's little things that change how you act. The other side is Medicare Advantage plans in 2025 have changed dramatically. One of the issues is the $2,000 max out of pocket also applies
Okay.
for any Medicare Advantage plan that has prescriptions with it. So it's not just one side of Medicare, it's on both sides. But you should have by this time, although federal law says October 30th, you should have received your update from the plan you're in, your Medicare Advantage plan.
Okay.
Highmark, Blue Cross, Aetna, United Healthcare, it doesn't matter. You should have received or will receive very shortly their information on the changes for 2025.
Okay.
One of the big changes that you really need to pay attention to, all these years when you went in the hospital, if you had to go in, it used to be a per stay fee. So if you were in for 5 days or like I was 12 days, no big deal, okay? They changed to a per day fee. And I've seen those per day fees as high as $475 per day. Now, you go into the hospital and you go through all that you're going through and you're trying to get better and all that kind of stuff, and they're going to discharge you. So it says on the plan, the first 7 days that you're in the hospital, you owe $475 per day. Well, you have to send your honey. Oh, Ann, would you please go down to the billing office? Why? Well, they're asking for that money right now. 475 times 7. And we look at each other and go, well, use the credit card, okay? So you need not just to pay attention, okay, my plan, it's high mark, it's fine, it's all this kind of stuff. I'm doing this, I'm doing that. But look at specifically, what is the specialist cost? If you have to go to a specialist, is it a $45 copay? Because when you go in the door, the young lady's saying that'll be $50, that'll be $60. If you're going in the hospital, know the per day fee. Many of the plans have changed now where both lab and an x-ray you have a copay for. Not just an MRI, not just these CAT scans, not the specialty ones, but a regular x-ray. And I've seen a couple of those at $40. So you run down, and I'm saying, I'm going to get an x-ray. Okay, I got to get an x-ray. All right, you can do the x-ray. And they do, excuse me, how much? $40 before you get the x-ray done. Yeah, these plans have changed dramatically. You need to look. The premiums, again, there are 0 premium Medicare Advantage plans. They go all the way up to $295. And again, you don't have to pick the $295 plan to get the best benefits. You need to study the plan a little bit and say, okay, this will work for me. You're in a Medicare Advantage plan. You're in there for 2 years, 3 years, and all of a sudden you blew your knee out.
Yep.
And yet, oh, I got to get a knee replacement. And you go, okay. And you find out after it's all said and done that you put out, pick a number, $5,000. And you go, where did that come from? Every one of the Medicare Advantage plans has something called out-of-pocket money. And there's a huge range, $3,500, and the high is $14,000. So you need, when you say to yourself, my Medicare Advantage plan, it works perfectly, I don't pay anything, I get everything all done, you better study in 2025 because the numbers have changed. And if you have $5,900 in out-of-pocket money, and that's in-network, so just so you know, in-network means that wherever you're getting your health care taken care of, they participate with that particular plan. Not all the plans participate with all of them.
Right.
I know we see all the time in the word Geisinger. Well, neither Tower Health nor Penn State take Geisinger. What? No, you can't go to the hospital. You can't. You know, you got to go St. Luke's, you got to go Allentown, you got to go north, you got to go west. Geisinger doesn't participate with them. So you better look at your Medicare Advantage plans. Now I know, it's all natural in me after 30 years, but for all of you out there, this is the one year, the one time then I encourage all of you to take a serious look at what coverage you have now. There might not be anything wrong with it, but take a serious look, read what they sent you, look and make sure that you understand how your plan's going to work. And if you want to change from one side to the other, this is the time to do it. If you want to change back again, come back to traditional Medicare, it's perfectly okay, you can do that. The other part, the state of Pennsylvania has the most wonderful prescription plan. It's called PACE and PACEnet. And they both have income levels. PACE is the lower income level, PACEnet is the higher income level. How does this help you? You should definitely look and see if you qualify for that, because that Xarelto that I was talking about, that was $600. Under the PACEnet program, it cost you $15.
Wow.
$15. So if your grandma, your aunt, your mom, or yourself don't understand, what am I going to do here? PACE and PACEnet is the perfect partner to go with it. If you're in a standalone, a prescription drug plan, because you have traditional Medicare, you can add PACE or PACEnet for free. If you're in a Medicare Advantage plan, you could also add PACE and PACEnet to that. So those very expensive drugs, those ones that are, I don't know what to do. I guess I'll just eat crackers this week.
Exactly.
You know, PACE and PACEnet. We need to look at that absolutely at every one of you and say, do you qualify for that? You know, and if you qualify for it, then you are in a great position to be able to go to. And then the beauty of it, Ann, is PACE and PACEnet is at every pharmacy.
Oh.
Every pharmacy.
Okay.
You walk into not just the preferred, because, I like this one. You can go in and use your PACE and PACEnet card. If you're going to a pharmacy, you give them your Part D card, or you give them your Advantage card as your ID. If you have prescription coverage with it, you give them your PACE and PACEnet card, and you will get your best deal ever, and you will save tremendous amounts of money. Remember, Medicare Advantage plans are made up of HMOs, health maintenance organizations, and PPOs, preferred provider organizations. I will say this, and I don't, the PPO is the better choice. HMOs are a harder choice for all kinds of reasons.
I don't want to say restrictions, but requirements for referrals and all kinds of things.
Absolutely, absolutely.
And is it, we have about 2 minutes, is it difficult or very difficult to change going from one or the other, the traditional to the Advantage, or the Advantage back to a traditional?
No, it really isn't difficult now. When you get into May and you're going, then you're in some real difficulty. There, in the Medicare Advantage plans, the typical open enrollment is October 15th to December 7th. The Medicare Advantage plans has a second one, January 1st to the end of February. And you can come back to traditional Medicare at that time, or change another Medicare Advantage plan. But that's another confusing part of it. You know, if you put into your mind, this is the time, it's going on right now, I really should look.
And you've got some counselors available. 1 minute to wrap up. Any quick words of wisdom for us in this ending?
I would quickly say to all of you, if you really aren't going to take a look at it because you think it's too difficult, please call Berks Encore, get a PA Medi-Counselor. We will gladly go over all of the issues with you and make it as easy as possible so you can make the right choice. We don't make the choice for you. You can make the right choice to do that. That would be my best piece of advice.
And I think that's great, and I think I'm going to add a tag to that that says, and it's for you, so you make your own choice for your circumstance. Don't necessarily choose what your neighbor or relative has because, oh, well, it's good for them, must be good for me. So I'm going to reiterate again, thank you so much, John, for helping us to be prepared as best we can, at least with some base knowledge for some of the changes happening with Medicare for 2025. Please, if you need to, call Berks Encore to make an appointment with the counselor to discuss your current situation and options for yourself. And you can always call us at the Area Agency on Aging at 610-478-6500, and we can direct you to the PA Medi-Counselors at Berks Encore. Again, thanks so much, John.
Thank you,
I appreciate your
Ann. Thank you.
expertise and sharing that with those that are tuning in. So thank you for tuning in to Aging Matters.